valuable and useful information.
Yeah. Yes, Jen.
My first question is, it is generally said that the virus remains in the air, or it can travel up to 10 meters. Now that seems to be very scary, kind of thing. For example, if you go outdoor, I go for a walk in a park, and if somebody has crossed that path, and I mean 10 meters means more than 30 feet. So my question is, how long it remains in the air, and is that what is the probability of having it for all the 10 meters, and for how long?
Thank you. I think it's a very, very important question and very interesting question. So there has been lots of studies done on that, and as you said that the virus spreads very fast. I totally agree. So that's why in UK we were allowed to go for one exercise a day. So because all the research have shown that if you are outdoor and if you are not in the crowd, so still if you're outdoor you have to wear the face mask, and if someone comes near you, you just turn yourself so that you are not facing that person. Okay, so if you're facing a person, then the droplets you have straight away comes on your face. Okay, so that's one thing. Secondly, if you are indoor, then you should open all the windows and the door so that you have free circulation of the air. But these are the things which you said which cannot be avoided. We don't have any control, you don't have any control, you can only take precaution. So that's why it was advised that all the people to stay home. If you have infection, if you have been tested positive, stay at home so that you're not giving the infection. And if you're asymptomatic, then you probably most probably don't know, then still you wear the mask and then you stay away. So that 2 meter was the distance which was even WHO and everyone agreed on. That 2 meter is a good distance. I know India is airborne now, and at the moment the virus is in the air, which is something which we don't have any control on. But yes, I would say social distancing, having mask and hand hygiene. I think these are things will help you to uh, to win over this virus.
Thanks, sir.
Thank you again
Abhishek ji,
for
as a
your.
admin, can you mute everybody else except for the speaker?
Yes. I will mute. Yes. Hello, sir. Abhishek
Yes.
Kumar from this side. One of the important question is people are confused in India about the vaccine. Somebody say about Covishield, somebody say Covaxin. What is the difference between Covishield, Covaxin, or Pfizer, Moderna? What is the
Okay.
difference?
So all the three vaccines are equally effective. So Moderna is the vaccine which is recently been approved in even in UK. They have not started giving it, but they will be giving it. So these are the choices you have. So can you hear me? Can you hear me?
Yes, you are audible.
Okay.
we can
So
hear you.
I would say that instead of going into the details of the vaccine and going into the nitty-gritty of the vaccine, whatever vaccine you can get it, please go ahead and get it, because at the moment I can see there's not much choice about the vaccine. It's the at the moment the vaccines are in scarcity. So whatever vaccine you can get, all the three vaccines have gone under rigorous trial. They have been validated. They have been approved by the scientific committee. So I won't say, and I'm not an expert on the vaccine. So I will say whichever vaccine you can get hold of, please go and have it, because that's the one thing which is going to protect you in long run. As I said, if you have one dose of the vaccine, you are 62 to 65% protected. For the second dose of vaccine, you are 92 to 95% protected. So far, all the studies have shown, as I have shown you in my PowerPoint presentation, that up to 6 months the immunity will be there, and after that we don't know, the immunity might last. So whichever vaccine you can get, you please go ahead and have it. There's not much difference in any of the vaccine, because all have undergone rigorous trials and all have gone through a rigorous monitoring and through the scientific committee. Thank you.
But sir, a government are extending the gap between two vaccines, but people are confusing what is the proper gap.
Okay, that's again very good question. So when the vaccine came to the market, even in UK, this confusion is still there. They first said you can have vaccine after 3 weeks. So I was very lucky enough. So I had first vaccine in December, and after 3 weeks, on 24th day, I had the second vaccine. But then after the government realized that they may not have enough supply, so, and then they had some more data and they did some research and they said up to 12 weeks, that means up to 3 months, you are okay to have the vaccine, because they think after 3 months, your immunity will start waning off. So from 3 weeks up to 12 weeks, anytime in any window, if you can get, please go and have it. So first vaccine, and one more thing I would like to tell here. Once you have the vaccine, don't let your guard down. Don't think, oh, now everything is hunky-dory, you're fine. No, you're not fine. Once you have the vaccine, yes, it's going to give you protection, but first it will take 3 weeks for the antibody to develop. So first 3 weeks, you're not protected. Okay. And after that, you're only 62 to 65% protected for the first dose. And when you have second dose, 92 to 95%. But still, there are people who had vaccine, they have had the illness. There are not many people who have died, but some few, very few had to be hospitalized, and people had mild infection. So the good news is that once you have both the doses of vaccine, you will have some mild, we can have mild infection if you're a bit unlucky, but yes, but don't let your guard down. I mean, what I'm trying to say, still wear the face mask. I had both the vaccine, but still whenever I go out, I put my face mask. I use hand sanitizer all the time, and we keep a distance from the people. So please follow the basic thing: hand hand sanitization, face covering, and keeping a distance. Thank you.
Thank you, sir.
Next.
Next, Hariji. Yes, ask your.
Yeah, yeah. Good evening, Sanjeev sir. My name is Hari Kuti, and I am from Mumbai currently. So my question is related to the test.
Mhm.
So the test that is we are doing right now, RT-PCR or maybe antigen. So what is the reliability? How much can we rely on that test? Whether it is a what is the efficiency of the test? Whether it is true or not? So how that can be done? And another one more question is it is like the epidemiologists say that this COVID will be there for another 5 to 10 years. So how do we go ahead with this? Like how do we survive? Right.
Thank you. Okay, so again, it's a very good question. So there are three types of tests available. So one is the conventional test, COVID test, which takes 48 to 72 hours. Then second one is the RT-PCR test, and third one is the antigen test, which is recently been launched in India. I can see that, and which is there in UK for last 6 months. So let's talk about the third one, the rapid antigen test. So rapid antigen test has been a game changer in UK. So let me tell you how we work on that. So rapid antigen test is like a pregnancy test, where you take a swab from your nose, and then there's a diluent in a solution where you put that swab in that, and then take few drops and you put on a slide, and then you get positive or negative within half an hour, 15 minutes to half an hour. You can get the results, and this test is, the accuracy is 97%, specificity is 90%, and sensitivity is 97%. And this test has been a game changer. I tell you how. So when we had the second wave, all the schools were shut, lots of people went on sickness, all the staff, we were losing lots of staff. And because this, unless you have the proper test, which takes up to 72 hours, like RT-PCR or other swab test, you have to wait, and then you don't know whether that person is positive or not. But if you do this bedside rapid antigen test, you can get the test, you can get the report within 15 minutes. So that is a very good screening test, I'll say. If you have a doubt and you want a quick answer, or like now at the moment in UK, all the doctors, when we are going to the hospital twice a week, we have to do this test before we go to the hospital, because we need to make sure we are not carrying the virus without our knowledge, because 1 in 3 people, they have done a study, are found to be asymptomatic carrier, meaning you are carrying the virus, but you don't have any symptom, but you are still a source of virus to other people. So and all the schools, all the children, they got back. So we don't have any online schooling. Everyone is going back to the classroom since March 2021, because they all have to do this rapid antigen test uh, twice a week. So this has been really a game changer. And now UK, with the success of this rapid antigen testing, UK government has given every household 7 test kits every week. So every week in our house, we're getting 7 tests, rapid antigen tests, and we all do it so that we're not carrying the virus. If it's positive, then we isolate or we go for RT-PCR. So RT-PCR is more expensive, it's more time consuming, and it takes 48 to 72 hours to get the test. So if you are positive on the rapid antigen screening test, then you go for the RT-PCR test, which is more, which is again one step further. So it's more accurate, and but as its sensitivity and specificity is very high. But rapid antigen test has been approved by MHRA and all the European committees, and even in Indian ICMR, and it's quite a reliable test. So I would say you can do any of the tests. If you want to do a rapid screening, go for the antigen test. If you want a more reliable test, then you and if it's positive with the rapid antigen, then you can go for the RT-PCR test. Both are equally good tests, Hari. And regarding your second question, we don't know what the future holds. I think more and more people get vaccinated. Like UK, 75% of people are vaccinated now. So are we free to do whatever? Like, no, we are not free. Still, we have not gone out. We are not meeting people. We're not going abroad. I can't come to India because India is in red list. If I go to India and come back, I have to go for 2-week hotel quarantine. So whole world had to be immunized. Till the whole world gets immunized, we are not free to do whatever we like. So I totally agree. So we have to live with this virus. We don't know how long it'll take. It might take 1 year, 2 years, few years till the whole population gets immunized and we have a good level of herd immunity, and then that will be the way forward. So you can say it's a sort of third world war we are in at the moment, Hari. But it's a very good question. Thank you, Hari.
Yeah, doctor, I had a question. So, like, what are the conditions based on which a patient is transferred from no oxygen to concentrator, then from concentrator to BiPAP machine, or from BiPAP machine to a ventilator? Like, what are the conditions that should be looked into?
Okay, so that's again a very good question, which is more of a medical people need to handle that. So once you are at home and you get new shortness of breath, you are not able to breathe, okay, chest pain, things like that, and you do your oxygen, you have an oxygen monitor and you check your oxygen level. And if your oxygen level is say 90 to 92, you can manage for a few hours. You lie down in a prone position meaning on your tummy. And all the studies have shown that it will improve your oxygen saturation slightly. See if that works. If that works and your saturation is maintaining above 92, you can stay at home. But any point of time, if you feel the saturation is going below 90, you can't stay at home. You have to immediately dial for the ambulance or go to nearest hospital there. Okay. Once you go there and then do one more thing I thought I will discuss here, that this virus infection, whoever gets this infection, then at the same time you're quite prone or to have other bacteria infection at the same time. Okay. So the people get secondary bacteria infection while you're having a COVID infection because your immunity is down. Your the CD4 level cells are gone down. So your immunity down. So that time you are more vulnerable. So all the bacteria, fungus, everything will attack from everywhere. Okay. And your saturation goes down. So what do you mean by saturation going down? That means that your body's demand for oxygen has gone up. Okay. And your body is not coping. So you have to give supplemental oxygen. So what the doctor will do in the hospital, first they try on room air. Okay, room air is what you're getting, and they put an oxygen mask. And if the oxygen mask is not holding, then they will try to put you on BiPAP, or before that you can also try oxygen concentrator. But you need a very high power oxygen concentrator to give you 70, 80, or 90% oxygen. Okay, or they can try a BiPAP. BiPAP is a positive airway pressure. So with that they can maintain. But for that, the cooperation of patient is very much needed. Patient had to be alert and had to be breathing and talking. He had to be conscious. Then only the BiPAP will be successful. And if BiPAP is not successful 2-3 days, if they're not cooperating, they're getting more hypoxic, saturation is going down, then he will need to be shifted to ICU, and then he'll need ventilator. So this is how, but I think that will be more for the physician who is dealing the patient. I think he had to do, and they are on the way, they'll have to do blood culture, they have to do arterial blood gas, a lot of tests they have to do, CT scan to find out how the lung condition is, and then decide accordingly. Thank you, Jayant. It was a good question.
Thank you. Thank you, doctor.
Chandan?
Yeah, sir.
Yes.
Yeah.
Let if anybody else has any question, they can ask.
Or anything in the chat?
Can I go, Chandan? Abhishek,
Yes, go.
Yes.
Yeah, go ahead.
Hi. I'm just conveying my pranam to everyone here. I'm Abhishek. I'm from Odisha, and I'm Atul Bhai's junior. So I'm involved in ICMR with developing test kit for the rural areas, and also we are seeing that current scenario of how we can tackle the third wave, which we are seeing, which is inevitable. And so the basic things, couple of points which I would like to discuss about is the drugs which are being currently prescribed for the management. I think that's been seeing the Indian population and the economy. They've been formulated those drugs which are in current management. I think our population goes with solution to the doctor that I have a symptom, give me the medicine. They do not really listen, and this is something which we all know. But however, when we see the recovery, it's quite good, and we are there are a couple of clinical trials also going on. Those drugs been given, and considering the fact that those drugs are generic, we assume that this could be helpful, and it is helping in a lot of way. People who are staying in their home and they're taking medicine. Regarding the test, what we are doing, basically, I got a question here in the panel. I am in Germany. I'm working with German Aerospace Center. It's a ESA project, European Space Agency. I'm a gravitational biologist. Ajit ji asked me actually. But I am involved in ICMR for the rural India setup, where we can bring the test, such as Dr. Sanjeev said, the rapid antigen test. We are bringing the RT-LAMP test, which is PCR-based, two-step heating, and from the saliva again. And so we are trying to bring the test handheld again, like the same antigen test. So we hope it will be implemented soon through ICMR. One thing I'd like to ask Dr. Sanjeev is how you see that mutations were occurring. And today we see there is a clinical trial report come against B1.617.2, and they compare two vaccines, which is Pfizer's vaccine and AstraZeneca vaccine. They see that the first dose actually protects to only 30%. That means if you take the first dose, and if you have the mutation, the 61.2, which is, and you're actually protected 33%. And how you see that, and what will be your message? Because a couple of friends have been panicked a bit, because I hope you are aware that Government of India now extended the vaccine gap period to 3 months. So do you see that there will be a challenge? And do you see that if the mutation grows in Indian population, how gonna you answer? Thank you, everyone. And again, I'm thankful to Atul Bhai bringing me here. I will be very helpful to help our community back in India. Thank you.
Thank you,
Thank you,
Abhishek.
Abhishek.
It's a very nice question, and I think you're doing a great job. So yes, going back to your mutation and the vaccine. So I don't know the data which you're talking about, but today I was watching the BBC, and they claim that Pfizer and AstraZeneca both work on the Indian variant, and they're providing 91.7% protection against the Indian variant. So UK government at the moment is very, very concerned, because we have 277 Indian variants in UK at the moment. So we though we said that we have we had a good victory over the COVID infection, and really the number had plummeted down, and the mortality was in two-figure, 10, 15, less than 20 for last few weeks, and the positive coronavirus was only say 2,000, and as the UK, more and more people are getting vaccinated. Around 75% of people have been vaccinated. So the Indian variant has been a challenge for the UK government, and they are very concerned about it. But however, AstraZeneca and Pfizer both have assured the government today, and today it came in the BBC very interestingly, and they said no, they provide up to 92% of the protection against the Indian variant. I don't know where you got this figure from, Abhishek, regarding 30%.
I will share you here in the public forum that this data
Okay.
is been today it is actually come out.
Yeah, okay,
So
okay.
I can share
So
this one.
yeah, no, that's fine. I mean, I don't dispute the data, what you're saying. What I'm trying to say here is till, see what is the chances of virus getting mutation till or everyone in India or wherever you are immunized, the virus will have a chance to jump from one person to another person. So you need everyone to get immunized so that virus doesn't have chance to change or mutate. That's the only answer. Forget about the vaccine. First, you all get vaccinated. Then we can always talk about whether that vaccine is working on the mutation or not, because that is the epidemiologist or scientist work to research into that. But my plea will be that all this data should not uh, make people shy away from taking the vaccine, because then that will not be good. Then there won't be people who are vaccinated, and then virus has more chances of mutation than people who are vaccinated. So please don't get swayed away by all this data or put you off. Please go ahead, have the vaccine, whichever vaccine you can get hold of, and whenever you're given the chance to have the vaccine, because that's the only thing which is going to protect you other than having all the other things. Yes, I know it's a scientific debate how much is going to protect or not. I'm sure even scientists here are working day and night, and we are planning to have the third vaccine in October, so that we get more protection from all the other variants. So I'm sure the Indian scientists are they are far superior to any scientist in the world. They will find out some answer to all the variants and the mutation and the efficacy and effectivity of the vaccine. So hope that will answer your question, Abhishek.
Yes,
Hello, doctor.
absolutely.
I have got one question.
Okay.
Hello.
Yes.
Doctor, in India, we mostly believe in yoga and pranayama. And it is said that these certain breathing exercises in the form of pranayama, they help you in prevention. And once somebody catches it, say at least in the milder stage, that can help fight the virus. That is your immune system is strengthened to that extent. What is your advice or what are your views on this role of yoga and pranayama in prevention and fighting of coronavirus?
Yeah, I mean, I think we are going back to our old traditional medicine. Yes, I'm fully. I don't have any scientific evidence to back that up, but I don't see that it's going to do any harm. So you can, yes, yoga, pranayam, meditation, all are help. Every little will help. So that will help, and deep breathing exercises. Only make sure that you don't have any person in near vicinity, because you don't know whether you're carrying the virus or not. So because 1 in 3 in UK and 1 in 2 in India, people are asymptomatically carrying the virus. So when you're doing all the breathing exercises, make sure that no one is in 2 meter distance. Probably make sure that you're in a different room, and so that you don't catch infection from other. But yes, I will say please go for it. It will help. It will deep breathing exercise of any form will help you.
Thank you, doctor.
Hello, sir.
Now, doctor, there is a great, talk. There is a lot of panic in this country when people talk of third wave, impending third wave, and it is said that it is going to be very, very much more deadly than the second one that we are having at present. What do you think? I mean, is the possibility or probability of having a third wave, and if we are going to have it, then at about what time it is likely to happen?
That's a million dollar question. I wish I could answer that. So at the moment, India is going through the second wave, and it's not over yet. I think still lots of people. The hospitalization is very high. People are still dying. Young people are dying. I have lost two of my people I know, very young, 32-year-old, and there's a very good possibility of third wave. But the only way you can prolong the third wave from coming, or you can avoid the third wave coming, if people get vaccinated. That's the only answer, because once more and more people are vaccinated, the virus have less chance to jump from one person to another person. That means less chance to mutate. So that's why in UK they're saying not third wave. We are saying there might be upsurge. So then we said, why upsurge? Already 75% of the people of the UK are immunized. It's because the international doors will be open. People will be coming out, coming in. So people will bring the infection. So they will be upsurge. So don't worry about the third wave. My only advice will be get through the second wave first. Stay at home, protect yourself, protect your family, get immunized, and then when the third wave comes, we'll fight the third wave. Leave it to the politician. Let them do some work. Okay.
I appreciate.
Yes, sir.
Maybe Chandanji, can I just pitch in here?
Yeah, please.
I mean, so that's a wonderful thing, because the scare, what we are seeing is like, the variants as the mutated, it's being challenged for the kids. This is assumption or the database, very little data to back. That's a fear. If the third wave hits, and if it affect the kids, this is going to be a real problem. And why I say third wave and how we must prepare is because we are trying to control the airborne thing, and because we cannot keep lockdown for a long time. At the same time, we have to control the crowded place, such as schools, such as hospitals, such as, and how we can bring innovations, how we can bring technologies to support that. Sometimes when you now brought the rapid antigen test, this must be there in the school every week, twice. This must be done. At the same time, how we can control the school environment in a closed room, how we can control the air, so that at least we can give a good healthy air to our kids. Because it's sometimes I do not want to go to any kind of assumption here, but I think it's time, seeing the virus is so dynamic and it's so fast mutating. I think people should be a little concerned about and predict that when the winter will come, it should not go bad to worst.
Yeah.
But that's my
Yeah, no, I totally agree, Abhishek. And we all have to be worried. We all have to be fearful of third wave. Can I invite one of my colleagues from UK, Dr. Anup Sarkar? I know him for last 10 years. He works, he's a family physician. Anup, are you there?
Yes, I'm here. Can you hear me?
If you want to add, yes, I can hear you. Do you want to add something on mutation and vaccine, please?
Yes, the question is a very valid question about the mutations, like a B117 in UK, then B1617 in India. Variation will keep on happening. There was happening in South Africa. They are happening in Brazil, and again, probably if the third wave comes, it will happen. But the thing is, when there, as you said, Dr. Maskara before, when there is a much mass gathering, more people mixing up, then the virus get a chance to get mutated. But if we can follow this primary measures to avoid the infection spreading, then probably we could carve down the mutation as well. And even if there is mutation, these vaccines we are using now, these are messenger RNA vaccine, and they can tweak into it so that it can fix new and address new mutations. So that's one way, because as you said, the vaccine is probably will last 6 months or maybe longer, and in UK we are thinking about booster dose. So when there will be a booster dose, then people could be quickly, and it could be mass produced, and vaccine could address those mutations. And so first thing would be to avoid virus spread so that the mutation doesn't happen. And if the mutation happens, then this vaccine can address those things. So this would be my addition here. But I think it's a valid question, and we already got the answer in the floor.
Thank you, Anup. Yeah, and
Thank you, Mr. Sarkar.
Yeah, I would really like to. Yeah, thank you for your contribution. And as you rightly said, that each time any mutation is happening, we are learning more about the virus, and the scientists are gathering more data, and they're putting. And it's very easy to tweak the vaccine. So don't worry about all the fine details about the mutation and the virus. First thing will be to protect yourself and follow the basic hand hygiene, covering yourself with a face mask and social distancing. If you do all the basic things, I'm sure we will overcome this COVID infection. Okay, next question.
Yes.
We have one question from Mr. Rajneesh Pathak.
Yes, Rajneesh.
Hello, Doctor. Good evening to all. Sorry for being joining a bit late. So I'm not sure if somebody has already asked this question. I have a question that in India nowadays, we are hearing about the black fungus, which is generally coming to the patient who has already been vaccinated. And some of the studies says that this is because of the zinc and tablets that were being used or excess steroid or something. But 14 more than 14 states have declared this black fungus as a new pandemic kind of thing, and so what's your uh, means take on this? What is this, and how can this be prevented?
So that's again a very good question. So this black fungus has we have not seen much black fungus in UK, but there could be various things.
Yeah,
Various
neither in India. In
in
the first
India.
wave, we have not heard about it. Yeah.
Yeah. So in India, it has. So what is the reason behind it? So because uh, so when people started using, because it's very easy to get medication over the counter in India. Medications are not that heavily regulated. If you want to buy anything over the counter in India, you can buy it without even a prescription. But UK, all the medications are very heavily regulated. Without a doctor's medication, we can't get anything. Even my wife can't get anything. I can't write a prescription for my wife because that will be unethical. We have to get another doctor to write for her. So what happens? The black fungus, which is a mucormycosis, which I did talk in my presentation, that it's a black fungus. And what they found that people with diabetes, people who are immunosuppressed, and people who have had overuse of steroid. I mean, the steroid recommendation is 7 to 10 days dexamethasone, or you can use prednisolone or methylprednisolone. If you have used it without any discrimination, indiscriminate use, or if you had very high blood sugar, your diabetes were not under control, if you are on chemotherapy or if you are immunosuppressant, you are more likely to get this fungal infection. And yes, I do agree. People who have had the vaccine, they also got this. As I said, we don't know everything about this vaccine at the moment, at this virus. We are learning as we go by. So, but still, I would say this all should not put people off from taking the vaccine, because at least you will get some protection, not 100% protection, and nothing is 100% in science. So the mucormycosis is a medical emergency. If you get any discoloration of your nose, if you get blurred vision, double vision, severe headache, any of these symptoms, then you should immediately contact your doctor. You need to have a CT scan, and you need to have immediate therapy. Okay, that's what I can only advise at this moment. And the vaccine, people who are vaccinated, if they get this infection, I would say probably they are a bit unfortunate, because as I said in my talk, the people, that 1 to 2% people who are immunosuppressed or who have any underlying illness, they are the people, they are more prone to have vaccine failure, because these are the people who have some underlying illness, and then probably vaccine didn't give them 100% protection. So that is how we can explain that. But as I said, we don't know everything about it, and we are still learning about it. Thank you. It was a good question.
May I
Thank
add, Dr. Sanjeev?
Thank you,
Yes,
doctor.
please add.
These are the hospital-borne diseases. Mostly, first of all, when you go to hospital, you are in a cocktail of drugs. Like those you makes, for example, if you're taking azithromycin, if you're taking ivermectin, they all kill the pathogen present inside your body. And during that process, you really put a lot of pressure on the body of your immune system with the steroid. So what happens? The pathogens which they live in your body, they try get a chance to grow. So that's first thing. If somebody had developed these symptoms and sharing the bed before you, so probably that could be a cause. Second, hospital oxygen cylinder, the mask you are wearing, they're giving, that is also big source of getting this black fungus or some kind of infection, which we always see with the long-term ICU patients. So long-term ICU patients comes with a lot of complications of infections, secondary infection from the hospital. And this is why Dr. Sanjeev really stressed from the beginning that many of these symptoms can be healed in your home itself, without even a drug, rather than some dolo or paracetamol, which is wonderful advice somebody can take and really implement. Stay home and take basic medicines as per the need, rather than going for steroids from the beginning itself, unless until you go some congestion in your chest. And you must remember these. If you stay home and having doors open, windows open, and going to a hospital can not only cause a lot of stress, but also bring this kind of hospital-borne diseases. Thank you.
Thank you, Abhishek. Yeah,
Thank you,
no,
Abhishek.
I couldn't agree more with you. Yes, I totally agree. This fungus is in the air, and if you have any of the condition which can suppress your immunity, like uncontrolled diabetes, or you're on hospital environment where the infection is floating around, yeah, you have more chances of carrying this fungus. Thank you. I think we have only 4 minutes left, so if anyone wants to
Yeah,
ask a quick question, can ask.
you can conclude and give the takeaways for us.
Okay,
And
okay, sure.
before you conclude, I just want to say
Yeah,
that if
yes.
anybody would like to know more about yen, our website is n2020.org. You can visit and connect us for more information. Now, Doctor, you can conclude the session and give the
Thank you.
takeaways to all of
Thank
us.
you, Chandan Kumar. So,
here, just a minute, एक
yes.
5 मिनट का क्वेश्चन है, दो 1 सेकंड का, लाइक अभी जैसे हमारे कुछ बहुत रिनाउंड डॉक्टर्स जिन्होंने दोनों वैक्सीन की डोजेज ली हैं, उसके बाद भी दे हैव बीन not could not survive, they could not survive, so what's the reason behind it?
So as I said, yeah, it's a very good question. It's a very common sense question, and a lot of people have asked me this question. So thank you for asking that. So as I said, that nothing is 100% in medical science. Yeah, the vaccine then give you 100% protection. It only gives you up to 92 to 94%. So there is still 6% of people who will not be protected. That's number one. Second thing, anyone who has got any underlying illness, like as I said, immunocompromised, someone has cancer, diabetes, they are more prone to catch this infection despite of having the vaccine. And I would say, but the numbers are very far and few. Those people who had to go to hospital or who have died. I know it's heartbreaking if you had the vaccine and you're dying. That's not acceptable.
Sanjeev,
But as I said, yes.
I just to Chandanji and Sanjeevji, people need to engage, because I can create the Zoom link, which is unlimited time. So at least we can hear a lot of information from the people. If you allow me, I can create that, and so that we can engage more questions if you like. Otherwise, if you don't have time, then we can.
So maybe we can do a follow-up session, because I think it's getting late in India now. People must be getting fatigued of listening me, and it's almost more than an hour. So maybe we'll request Chandan to do a follow-up call, maybe in a month's time. So when the things are a little bit better and people can come back and we can join. So Jayant, I know it's a very good question, and I'm very sorry for your loss. But yes, as I said, nothing is 100% in medicine. So don't let your guard down. If you had 2 vaccines, still follow the normal thing: hand hygiene, social distancing, and face mask. Thank you. Good question.
Thank you, Doctor.
Thanks a lot.
Okay, thank you. So I would like to again thank Young Entrepreneur Network for giving me this opportunity to talk on this platform, and I'm very thankful to all of you for your valuable time and logging in today. And I could see there were lots of very good questions, very thought-provoking, intelligent questions, which really gives me the pleasure that I was able to answer some of them, not everything, but maybe I will request Chandan Kumar to do a follow-up call maybe in 4 weeks' time. Then we can see you all again, and then you can have some more questions and we can do some brainstorming, and then maybe I can bring some more new knowledge. But till then, I wish all of you a safe, wherever you are, stay safe, look after yourself, protect yourself, stay at home if possible, and follow the 3 basic things: hand hygiene, face mask, and social distancing. And if you are given the vaccine, please go ahead and have the vaccine. Don't let any knowledge or any data or any social media tell you that vaccines are not effective. No, I won't agree. I will say no, please go and have the vaccine, and I will meet again maybe in 4 week time. Thank you. Chandan, over to you.
Thank you. Thank you, sir. Thank you very much. We'll definitely do a follow-up, as you mentioned, after a month's time. And in the meantime, if anyone need any kind of a support, they can write to us directly, and we can try to get the help, even from Mascara, Dr. Mascara. If you want any help, we can connect Dr. Mascara and get the help to you.
No problem.
Thank you so much, guys.
Bye bye.
Well done.
Thank you very much.
Bye.
Thanks. Thank you very much.
Thank you.
Bye. Thank you.